Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
An ACL injury is the tearing of the anterior cruciate ligament, one of the major ligaments of your knee. Now, ACL injuries most commonly occur during sports that involve sudden stops, jumping, or changes in direction. And that's a lot of different sports.
That's kind of sports in general.
Basketball, soccer, football, even downhill skiing. Now, depending on the severity of your ACL injury, there are a couple of treatment options. One is to let the swelling go down and then rehab the knee, regain the range of motion, and strengthen the muscles around the knee to help stabilize it. And, of course, the other is surgery to repair or replace the torn ligament, followed by rehabilitation. And some of the recent studies have shown that the long-term results of either method are really about the same. So there's some controversy, some difference of opinion.
But keeping it from ever happening is the best option of all, and there are steps that you can take to help prevent an injury to your ACL. Research has shown that it's extremely important to have proper mechanics and technique in sports movements to prevent ACL injuries. Here to discuss is co-director of the Mayo Clinic Sports Medicine Center, Dr. Ed Laskowski. Welcome back to the program, Dr. Laskowski. It's good to see you.
Thanks, Tracy. Pleasure to be here.
Thanks, Dr. Laskowski, for being here. You know, we hear a lot about the ACL, and it seems like it's happening, particularly to professional athletes who seem to all undergo surgery to repair it or replace it.
I was just going to say, knock on wood, that it doesn't happen at this weekend's football game. It's kind of a big,
the Vikings are playing,
kind of a big deal. Oh, you don't care?
No,
Please.
I don't care. So explain to us exactly what this ligament is. Everybody has heard about it, but what is it and what does it do? Why is it important?
Well, Tom, the ACL controls the forward movement of the lower leg bone, which is the tibia. So anterior cruciate, and cruciate means cross. So there are two crossing ligaments in your knee. One is the anterior cruciate ligament.
Anterior meaning front.
Anterior meaning front. So it controls the forward movement of that tibia. And the posterior cruciate, or PCL, controls the rearward movement. And most oftenly, in, as you say, sports that involve aggressive cutting, pivoting, landing from jumps, that's when the ACL can get stressed and loaded significantly to the point where it may rupture. So if it does rupture, the problem with the ACL is compared to other ligaments in the knee, the medial collateral ligament, say in the inner aspect of the knee, is very highly vascularized, and it actually heals very nicely after we sprain it. But the ACL, once it tears, and that looseness remains. It never really regains its stability once its fibers are compromised.
What did you mean when you said it's highly vascularized?
It has a good blood flow. So
Okay.
the tissues that have good blood supply usually heal very nicely, but tissues that don't heal that well. So the ACL, given its characteristics, its the tissue type and the blood flow supply, once it tears, it really doesn't knit together well. So we really can't primarily repair the ACL. And that's why you hear a lot about ACL reconstruction. We actually use another tissue in place of the native ACL that God gave us to restore that stability.
So the ligaments on the outside of the knee, you mentioned the medial collateral ligament. That's outside the knee on the inner side of the knee, and then there's the lateral collateral ligament on the outside of the knee, but they are both more vascularized, have a better blood supply than do the cruciate ligaments.
They do, yeah. So if you touch your knees together, you're touching basically the medial collateral ligaments together. That's their location. And those are commonly sprained. When we get hit to the outside of the knee, that ligament can be stretched, but usually, again, it scars up very nicely. It heals very well because of that good blood supply. The ACL, unfortunately, is one that when it tears and when its function is compromised, it kind of stays that way. It doesn't knit together well.
What about, isn't this a more common injury in females than in males? And do we know why?
It is. And you know, there's probably a lot of different factors. There was a lot of research earlier on hormonal factors, which may influence a little bit, but also the anatomy is different in males and females. Females have actually a shorter ACL, and it's actually a more V-shaped notch in the knee where that ACL is than males, so maybe more predisposed to tearing. And perhaps one of the most important parts is the way we activate our muscles. And we find that the way women use the muscles about the knee that protect the ACL, like the hamstrings, is different. And the movement patterns that women have sometimes when they land from jumps are different than men. And those movement patterns may predispose to ACL injury.
In my part of our opening script, I said, but keeping it from ever happening is better. So I don't want any of the football players to have an ACL injury, but I also don't want anyone, including myself, to have an ACL injury because I like being active and taking part in sports.
Right.
So how do we prevent this from ever happening?
That's a great question. And researchers here at Mayo Clinic, actually, Dr. Timothy Hewitt, along with many others, have looked at and analyzed movement patterns that are risk factors for ACL injury. And one of the movement patterns we've found, we call it dynamic medial knee valgus. What does that mean? Well, dynamic just means movement. So it's when you move, your knee goes medial or in. We talked about that medial collateral ligament being on the inner aspect of the knee. So the way we screen for this actually is we have somebody do a squat, and oftentimes a single leg squat. And when they do a single leg squat, that actually magnifies. We can see that knee dive to the inside. Ideally that knee should follow right over the foot on the way down. There should be a straight line mechanic of movement. But in people who are predisposed to have this injury, that knee dives to the inwards, inside.
So you can predict that be you?
Yeah.
So you can predict who's more likely to have an ACL tear.
Right. And in fact, even in our pre-participation exams, when we screen kids who are going into high school sports, we actually screen for that. And if we identify kids who have that movement pattern, we actually send a note home saying, we've identified this. It's probably a good idea that your child get a corrective program to fix that, because they'll be less at risk for injury.
Well, let's talk about that corrective program. Whether you are a teenager, a man or woman, what can you do? If you just said you can test for this at your own home, what are some exercises you should do?
So it's a great question. We always think of the ACL, since it is in the knee, work on the knee muscles, work on the quads, work on the hamstrings around the knee. But a lot of it has to do with things above that. We call it the kinetic chain of movement. Everything's connected. So the core, everybody has heard about. The core is all the muscles in the abdomen, the trunk, the back together. And then core stability is very important. And the hip links into the core. So we have a term we call lumbopelvic stability. Lumbo is the spine, pelvis is the hip, and we train the muscles about the hip, actually. We find that the hip abductor, and that's one of the muscles on the outside of the hip, is very important. When it is not doing its job, it lets that knee roll inward. So a lot of the exercises we do, they're not pure weight exercises. They're exercises involving training that knee to function normally when you walk and do movement tasks. So for example, we have resistance tubing. You can wrap that tubing around your lower legs and actually just stride forward with that tubing wrapped around your legs. So when you do that, you have to use that hip muscle to control your knee. And it's ideally done at first. We do it with a therapist, but also maybe in front of a mirror. So you can actually watch that knee. And the key thing is preventing that knee from going inward when you're doing that movement task. Same thing with the tubing wrapped around your ankles. You can do side strides and go side to side motions, all the time watching to make sure that knee doesn't go in. It's almost a neuromuscular training. We're training over and over again the right movement pattern to replace that bad movement pattern.
What do you mean when you say practice makes perfect when it comes to injury prevention?
Okay, and we qualify that a little bit. We say
perfect practice makes perfect.
Exactly. Perfect practice. So we can practice something, but if we're not practicing it with the right movement patterns and with the right technique, we may have a problem. So if we're throwing a ball and we, there's many things that we do in many sports movement patterns that can predispose to injury. So if you throw, and there's a thing called opening up too early. So if you face the plate and have your hips toward the plate too early, all that energy you generate from the ground goes back into the ground. You have to generate all the energy from your shoulder, and pretty soon you're going to have a shoulder problem. And we can fix the shoulder, but if we don't fix that movement flaw, we're really not going to fix the problem. So the same thing with the ACL. We want those movement patterns landing from a jump. Well, oftentimes we'll look at kids and we'll have them say jump down from a box, and we'll see their knees knocked together, and we'll say, okay, that person's going to be at risk for that ACL injury. So we'll train that perfect practice. When they land, we want them to stick it. We want that knee to stay stable and not roll inward. Those are the things that will protect them.
Would you say that anybody who is going to participate in competitive athletics ought to be screened for being at risk for an ACL tear?
I think so. It's so common, and that movement pattern actually plays into even more than ACL injury. There's a very common condition we call patellofemoral pain, which is pain underneath the kneecap that movement pattern plays into. It plays into some hip issues. Runners may experience the dreaded ITB, iliotibial band friction. That has been found to correlate with this movement pattern. So there's a whole bunch of reasons why we want that good movement pattern in and not that bad one.
All right, anterior cruciate ligament injuries and how to prevent them with the co-director of the Mayo Clinic Sports Medicine Center, Dr. Ed Laskowski. Thanks so much for being with us.
My pleasure, Tom.
We're going to take a short break, and when we come back, we'll hear how regenerative medicine treatments are becoming part of sports medicine.
You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.